talking about frauds and rorts, it was clear from the start what this new Medevac law was really about. It wasn't to fly sick refugees from Nauru and Papua New Guinea into Australia for treatment. It was really a rort to get illegal immigrants into Australia so they could never be sent back. And boy, the evidence is in that we were taken for a ride. Ever since Labor and the Greens, back then independent MP Karen Phelps, to ram that Medevac bill through the federal parliament last year when the Morrison government lacked the numbers to stop it.
Migration Amendment Urgent Medical Treatment Bill 2018 would address this crisis by allowing for the temporary transfer of people held in offshore processing centres to be brought to Australia for medical assessment and treatment.
Note that phrase, temporary transfer. A temporary transfer to Australia, on the word of two doctors, with the government almost powerless to stop them unless the patient was a national security threat. Temporary? Nothing temporary about it at all. 135 people brought out for treatment under this law as of a few weeks ago. Not one sent back, because once here, they sue to stay. So the government is now trying to repeal this law, and here is Liberal Senator Amanda Stoker last night in Parliament explaining just why, how it's in fact being rorted sideways by people supposedly flown in for urgent medical treatment.
Out of the 135 people brought to Australia as at the date of that hearing, only 13 of them had been to hospital at all. 5 of them refused treatment once they got to Australia, including the treatment for which they were specifically referred. Conditions like dermatitis, abdominal pain, dental pain and urological disease. A further 43 people refused an induction check, chest x-ray or pathology as part of their screening.
It's a joke, folks. And remember, it's not as if Australia doesn't already pay a fortune for medical staff to go treat these illegal immigrants back in Nauru or PNG.
In Papua New Guinea, there is one healthcare worker for every 14 people who are being kept there in offshore detention, and one mental health professional for every 37 detainees. In Nauru, there is one healthcare worker to every 6 people and one mental health professional for every 25 detainees. These are numbers that many of my rural and regional Queensland constituents would be envious about.
And remember, if these illegal immigrants really don't like the conditions in Nauru and Papua New Guinea, they could just go back home to Iran or wherever. In fact, 20 could have gone to the United States. It offered them asylum, but decided to be Medevac to Australia instead. And I've got to ask, is that because our welfare system is an easier touch? And get this. Of the 466 illegal immigrants we're told are still in Nauru and PNG, more than a third of them, 171, claim they're so sick that they've got to be Medevac to Australia too. A third. Now, I find it incredible that Labor is defending a system that's so obviously being rorted. But listen to Karen Phelps today, the architect of this ludicrous scheme, now kicked out of Parliament, still trying to explain it all away, even the case of a man who wanted treatment here after trying to inject stuff into his penis to make it bigger.
Examples of people being brought here for receding gums, gingivitis. There's also this story which you will have read about an asylum seeker who had a botched do-it-yourself penis enlargement being brought here. The question is that the sort of thing that you had in mind when you pushed these laws through?
I don't believe that the people who are experts medically who are assessing these cases, and there are 2 experts who are assessing it, the cases then go to the minister, and the minister has agreed in 86% of cases that they are necessary.
Now, actually, the minister's power to reject applications has been limited by this law. That was the whole point of it. Now, look, I can understand why some people just want all the illegal immigrants still in Papua New Guinea and Nauru to be brought here, just to end this saga. And I can understand that some might think that we can do this without starting those boats again. Now, I'm not so sure about that, but I can understand the argument. But what I cannot stand is the trickery. Oh, this transfer to Australia is just temporary. It's just for urgent medical cases. It's for people with terrible care back where they are. I mean, that sort of stuff is taking Australians for fools, and that is hard to forgive.